Olivia Barata Cavalcanti is the Director of Science and Programs over at the World Obesity Federation. She joins me now from London. Olivia, good to have you on the show. So being overweight is, I guess, a pretty good indicator to developing serious complications as a result of COVID-19.
Yes, since the beginning of the pandemic, different studies in different countries of the world have shown a strong association between high BMI and complications from COVID-19. And what we found in our report is that 90% of the deaths related to COVID-19 happen in countries that had the majority of their population being overweight or with obesity. So this is a pretty strong result that we found. And on one hand, it's not really surprising because we know that people with obesity tend to have more vulnerability in respiratory diseases. We've seen this with H1N1, with MERS, and even with influenza. But on the other hand, because of the size of the obesity pandemic and the seriousness of the COVID-19 pandemic, we really are seeing a perfect storm at the moment.
Olivia, tell me this. If this is the case, okay, what about the vaccination drives we're seeing across many countries? Right now, the priority groups are people who are working on the front lines, healthcare workers, as well as the elderly. If you are talking about these risks, if overweight people are much more at risk at developing serious consequences of COVID-19, shouldn't they be a higher priority in this vaccination drive?
Yes, you're right. They absolutely should. And in some countries they are. In the UK, a BMI of over 40 will put you in the priority list. And I think the important thing here is to really go with the science instead of just media narrative, because we're constantly fed this idea that people with obesity just lack willpower, of discipline, and they're lazy. When in reality, this is a complex, serious, and chronic disease. And if we look at the data, we see that BMI and age are the two strongest predictors of COVID-19 mortality and complications. So that should be the criteria for vaccine priority.
If BMI is a good indicator with regards to COVID-19, I'm wondering if there's science out there that shows how effective the vaccine is with people that have higher BMIs or classified as overweight.
So this is pretty recent research, obviously, because we've only started using the vaccine in the last couple of months. So far, most vaccines seem to produce the same amount of antibodies among people with obesity and overweight. We have seen a preliminary study with the Pfizer vaccine, but the study hasn't been peer-reviewed yet, that it's showing that maybe it doesn't produce the same amount of antibodies. We need more research. So far, what we know is that it is effective.
All right, Olivia Barata Cavalcanti, the Director of Science over at the World Obesity Federation. Thank you very much for joining us. I do appreciate your analysis.